Hi, this is June Phelps. I'm a clinical psychologist at Avenues of Counseling and Mediation. And today I'm going to take a little bit of time to talk to you about sleep during the COVID-19 pandemic. For many adolescents and adults and children right now, sleep has been disrupted due to an increase in our stress and reduced physical activity, reduced exposure to early morning light, which is really important for our sleep cycles. We're out of rhythm in terms of our meal times, and we have reduced social contact, and there's a lack of rhythm when we go to sleep. And all of these factors affect the quality of our sleep. So many people during this time are struggling with insomnia, frequently waking up in the middle of the night, and even an increase in nightmares. So I would like to provide you with some suggestions today that will help you with sleep during this really challenging period. And at the end of my discussion, I'll talk briefly about adolescence and sleep as well. The information that I'm going to be providing you today is based on a type of treatment called cognitive behavioral therapy for insomnia, or CBT-I. And this type of treatment has been shown to be helpful not only for those who experience chronic trouble with falling asleep, but also those who are in the midst of more of an acute stressful crisis that interferes with their sleep. Most of my recommendations, though not all of them, are based on information that was shared very recently by the European CBT-I Academy in an article on sleep and COVID-19 that's been accepted for publication in the Journal of Sleep Research. And I just want to note also that today I'll be talking about behaviors that we can engage in that can help us sleep more normally during this time period, but I'm not going to be talking about sleep medications. And a final note before I begin, sometimes trouble with sleep is associated with more severe mental health problems, with mood disorders, anxiety, depression, bipolar disorder, and trauma. And if you have any concerns about these mental health conditions or questions about them, or even want just more support in general for sleep disturbance for you or a loved one, please contact us at Avenues of Counseling and Mediation for what we call a diagnostic assessment and some recommendations for treatment. But let's go ahead and just begin with some suggestions to help generally with sleep during this period. So the first thing I want to suggest to you is to try to maintain a consistent rhythm in terms of when you go to sleep and when you wake up in the morning. While we all need different amounts of sleep to feel energized the next day, the average adult needs around 7 to 8 hours of sleep. However, we all differ in the amount of sleep we need to feel energized. So part of helping us to sleep normally and naturally is to figure out for you as an individual how much sleep you need. But let's say you need about 7.5 hours of sleep. What you would do is you'd pick a bedtime that you want to go to sleep at, and you need to try to go to sleep at this bedtime every night for the next week or two. So let's say you go to sleep at 11:30, then you want to set your alarm for 7.5 hours later, so at 7 a.m., and make sure no matter what to get up when your alarm goes off, not just hit the snooze, to get up right away when that alarm goes off. And by doing this, by going to bed at the same time and getting up at the same time, no matter how much you sleep that night, so even if you've just slept a couple of hours, you still get up at the same time. What you're doing is you're teaching your brain, this is the period of time when I go to sleep, this is when I get up. And your brain loves rhythm, your brain loves patterns. It's very cue dependent. I'm going to be talking about that in a minute. And so if you go to sleep at a regular time and you get up at a regular time, this is going to help your brain know when to go to bed and when to get up. As I mentioned just before, sleep cues are very important for helping your brain move from a state of being awake to a state of of being asleep. So a change in your consciousness. And one of the number one cues to help your brain know it's time to go to bed is your bed itself. However, your bed itself and being in bed is only a strong cue for sleep if the only things you do in bed are sleep or have sex. Okay, so if you are doing your work on your bed, watching television on your bed, looking, at social media on your bed, being on the phone on your bed, all of those different things, they weaken bed as a cue for sleep. So what we want to do is we want your bed to be a place where you're just sleeping or having sex. So move all those other things away from your bed, even if they're on the floor, or better yet, on the desk or in a different room. That will help you to fall asleep. Now, if you are in your bed and you're awake for more than 20 minutes, a very important suggestion, though one that's not particularly popular, is to get out of bed and then to do something boring until you start to feel more sleepy, and then get back into bed. Why do we suggest that? Why do I suggest that? If you're in bed and you're just highly alert for more than 20 minutes, 20 to 30 minutes, then your bed becomes associated with an alert state rather than a sleepy state. So once again, we want your bed to be just associated with being asleep or in that sort of groggy, fatigued state right before you fall asleep. So if you can't sleep, we want you to get out of bed, do something boring, not something stimulating, wait till you feel kind of tired, get back into bed. Later on, I'll tell you some things you can do while you're in bed to help you fall asleep in bed. But if you find yourself after another 20 minutes, half hour, still alert, once again, get out of bed until you feel a little bit more sleepy. Here are some specific things you can do to promote sleep. The first thing right now is to reduce your exposure to COVID-19 information, particularly prior to bed, but also generally during the day. You want to get the information you need to be updated, but constantly looking at the news and reading more and more, particularly right before bed, gets you very stimulated and often very anxious because there's a great deal of uncertainty about what are the next steps in how we approach the virus. So reading it right before bed is not a good idea, and just generally reducing your intake of information is going to help you with sleep as well. Exercise can be really useful in terms of helping you fall asleep. However, you do not want to exercise in the evening time, in that window about 3 hours before you go to bed, because that can also be stimulating and can make it difficult to fall asleep. But exercising earlier in the day is a great activity to do to help you sleep. Plus, if you get out during the day, you experience the light from the sun, and that also can promote sleep in the evening. Make sure the temperature in your room is on the cool yet comfortable side. Research shows we tend to fall asleep as our temperature falls. So when our temperature drops, and that helps our brain know it's time to go to sleep. And actually, right before we wake up, our temperature rises. So a really good temperature for falling asleep is about 66 to 67 degrees at night. You don't want to be too hot. You also don't want to be too cold. A white noise machine or a fan facing the wall can provide background noise that helps us fall asleep, particularly when we're feeling anxious. When we're anxious, we tend to, even if we're very lightly sleeping, to be monitoring our environment for indications of danger. And so if there are outside noises, there's wind hitting the branch hitting the window, or noises in the house, if you live in an old house, creaky stairs, whatever it might be, those kind of things can wake you up. And a white noise machine can help you once you fall asleep to stay asleep. Do not spend time looking at the computer or the phone screens right before bed. As you've probably heard through countless magazine articles, the blue light from our computers, from our phones, interferes with our sleep. So you want to, within, let's say, a 2-hour window of time, to have it be a computer-free, phone-free zone if possible. And definitely don't bring the computer or phone onto your bed. Keep your room on the dark side when you're trying to fall asleep. So once again, the brain is very sensitive to light and dark, and any source of light when you're trying to fall asleep, including light from your charger or light from your clock. If you have a clock that's lit up, can interfere with your sleep. So you want to keep your room really dark. Do not consume caffeine within 8 hours of falling asleep. That can interfere with your sleep. And if you're a big coffee drinker or eat a lot of chocolate, think about reducing that. Also, alcohol consumption can interfere with your sleep. It might help you initially fall asleep, but you're much more likely to have disrupted sleep. Try not to nap too much during the day. We want to increase the sleep drive right before you go to sleep. And if you nap during the day, that robs the sleep drive at night. Of course, people tend to try to compensate if they're not sleeping at night by sleeping during the day, but that actually undermines your goal of sleeping right at night. So if you have to sleep, just take cat naps. If you have to sleep. If you have to nap, just take cat naps during the day for no more than 15 minutes. And have the same pre-bed routine. Before you go to sleep, this is really important because we're talking about cues that help your brain know when it's time to go to sleep. So if you have the same routine every night right before you go to bed, whether it's shower, washing your face, brushing your teeth, getting into your pajamas, maybe reading a book for a little bit before you go to sleep, all this signals your brain that, yes, it's time to switch from a conscious state to an unconscious state. Once you're in bed, sometimes it's helpful to do a relaxation exercise or a mindfulness meditation, and even just noticing your breath as you breathe, counting 1 when you breathe in, counting 2 when you breathe out. And just doing that repetitive counting of your breath can help you fall asleep. The old go-to of counting sheep in your mind is actually useful. So those kind of activities can help you fall asleep. Also, what's sometimes useful before you fall asleep is to just review in your mind what you're grateful for during the day. Maybe 3 different things you're grateful for. A lot of times, right before people go to bed, they're reviewing their day and they're thinking about all the problems that they would like to solve. That is not something that is useful to do right before you go to sleep. What I suggest is that you have a time period during the day that you write down any problems or concerns you have, and maybe next steps you can take to resolve those problems, and put it in a journal. And when you're getting ready for bed at night, when your mind wants to go to review those problems, you just tell yourself, I wrote it down in that journal and I'm going to come back to it the following day, and I came up with a next step. And even if I don't know a next step to how to solve that problem, I'm going to go back to it tomorrow. Middle of the night problem solving has been shown to be nowhere near as effective as your problem solving during the day. So try that rather than use that time to just try to figure out next steps for your life. Sometimes people have catastrophic thoughts about missing sleep while they're lying in bed. Oh my gosh, I'm not going to be able to function the next day. What am I going to do in this meeting that I have? Everyone's going to tell that I'm exhausted. But research has shown that you tend to overestimate the negative effects of missing sleep, and other people tend not to notice changes in your performance in the way that you think they're going to notice. So remind yourself that even just resting is beneficial. And one thing you might try is something called a paradoxical intention, which is to actually try when you're in bed, try to stay awake. Put all your energies into telling yourself, I should stay awake. Lean into that. When you tell yourself it's okay to be awake, that missing sleep is not a big deal, and I'm even going to try to stay awake, you're leaning into something that typically you're very scared of. And when you lean into it, your brain reassesses and says, staying awake is not as bad as I think it is. You relax and you're more likely to fall asleep. One last thing, if you have nightmares, repetitive nightmares, which has been common during this period, people have been reporting having a lot of nightmares where they feel helpless and anxious, and some repetitive nightmares. And if the dream isn't exactly repeated, the theme of feeling helpless is repeated, or guilty or distressed. So one of the recommendations for you, if you have a nightmare, is the next day to write down that nightmare and then to re-script it, or write down that nightmare where right before something terrible happens in the nightmare, instead you write down something positive instead. So for example, let's say you have a nightmare in which you have a car accident. Maybe you would re-script it. So right before you hit another car, the other car shrinks and you go right past it. Or you become in some way a superhero that can just stop your own car and swerve around the other car. Or some kind of creative ending, and it can be fantastical, in which the feared situation or the terrible situation is stopped. You address it so it doesn't happen. And then what you do is you review this change script. You first do a relaxation exercise so you're more calm, and then you review this relaxed script throughout the day and before you go to sleep, this change script. So I hope some of these suggestions are helpful for you during this challenging time. And before I leave you, I just want to make one comment about adolescence. So research suggests that adolescents' natural sleep rhythm might be to go to bed later and get up later. And a lot of times parents are very concerned, particularly during this time, when they notice that their adolescents are going to bed at 12, 1 o'clock in the morning and sleeping in. And I want to let you know that this might not be such a terrible thing right now. This is a time when adolescents might be talking with their friends on social media, carving out more of a space for themselves, and as I said, connecting, and that might be actually a positive thing. So it's likely that it's okay for adolescents to go to bed somewhat later and get up somewhat later during this time, if they're following the majority of suggestions that I've recommended to you today. So I hope that this has been helpful for you. Please feel free to contact us at Avenues of Counseling and Mediation. We're here to help you. Right now we're doing teletherapy, and many insurance companies are waiving insurance and co-pays during this time so that people have access to teletherapy. My name is Dr. June Phelps, and thank you very much for being with me during this time as I share about sleep.